Hi, coming to the next video in developmental disturbances of tongue. So in this video, we will be discussing about lingual varices, also known as sublingual or lingual varicosities or caviar tongue. So lingual here refers to tongue. What is varices? So varices means your veins are dilated. Dilated means it has been widened, or they are tortuous or twisted. When your veins are tortuous, twisted, it is like similar to your varicose veins which we see in the lungs, which we will study in the oral general surgery part also. So it's similar to the varicose veins in the leg. So the veins will be dilated and tortuous. That's why the name is lingual varices or sublingual or lingual varicosities. Now what is caviar tongue? So caviar, the word means it is a food item. It is the fish egg. This egg will be somewhat resembling to the, I will be adding the picture. So it will be resembling to the seeds of the papaya. It will be somewhat blackish, purplish, shiny, small eggs. So here, this dilated or tortuous veins will be also somewhat resembling to those fish eggs. So it is called as caviar tongue. Now what is varix? It means dilated, tortuous veins. Dilated means they are widened veins. Now why is this becoming dilated is due to the increased hydrostatic pressure. So what is hydrostatic pressure? The hydrostatic pressure is the pressure which is exerted into the vein from the fluids outside, from the body fluids like blood. This blood is of any other fluids in the body. It's exerting some pressure on the vein which is more. When the pressure is more, when the hydrostatic pressure is more, we can see that the veins become more tortuous. Now, which is the most usual veins which are getting affected in the tongue, or the lingual, renal vein, and deep lingual or sublingual vein. Next, coming to etiology. So you can see I have written physiological aging. So your lingual varices is mostly seen in old age people. So it is somewhat related to aging. It's not something pathological. So physiologically, as a person gets older, this may get developed. This is called as senile elastrolytic degeneration. Senile means old. Since the veins they lose their elasticity. Since the veins lose their elasticity, they undergo degeneration. They undergo elastrolytic degeneration. So it is described as senile elastrolytic degeneration. Now we know this is always seen in the ventral surface, mostly in the ventral surface of the tongue. So in the ventral surface, the mucosa is a bit transparent, not like the dorsal surface. Due to the transparent mucosa in the ventral surface of the tongue, this is having a more visibility. Now coming to the features. So clinically, these lesions are told as red or purplish, short like clusters of vessels. They will be red or purple, short like clusters of vessels. They are seen on the ventral surface, then lateral borders of the tongue, and also floor of the mouth. Now, the other sites which are affected in the oral cavity are upper and lower lip, buccal mucosa, and buccal commissures. Now, the age, as I have already told, this is going to happen in an old age. So, mostly patients who are more than 60 years old are getting affected. If you see the gender predilection, both males and females are affected equally. There is no specific gender. Now, some studies have shown that the patients who have left varicosities may have higher chance of getting lingual varices, but it's not that proven. It's like a doubtful thing. Now coming to the treatment, most of the times patients may not require treatment for a lingual varices, but in cases if they need treatment, they can go for sclerotherapy or laser therapies, where they can correct the dilated or tortuous veins. So this is all about lingual varices. I hope you have understood the topic. See you again in another video with another topic. Thank you.